So here at the Suffolk County branch, we have been running a campaign for care staff, and it's called You Care, We Care. This campaign was launched in September 2020 to help support frontline carers during the pandemic. The branch has offered online support groups for carers, undertaking recruitment stalls and face-to-face action and discussions to help give practical advice for social care workers. Also, the branch has been sending out booster packs to members in care homes to thank them for their commitment during the pandemic. We as a branch also produced a video, and we've placed it on all our social media platforms to highlight the need for the real living wage. And we also held a rally, and this rally was held through the Ipswich Town Centre. We had guest speakers that attended the Suffolk University to highlight that all care workers should be paid at least the real living wage and company sick pay. This is the next part of our campaign. In tonight's event, we will hear from guest speakers and frontline care workers about their concerns on what can be done. The guest speakers are Christina McAnea from UNISON's General Secretary. So welcome, Christina. Kezia Pugh, Programme Manager at the Living Wage Foundation. Sandy Martin, Labour Councillor of Ipswich. And most importantly, our care members, Amila, Jacqui, Ewan and Amanda. Throughout this event, if you have any questions, then please could you put them in the chat box in the facility on Zoom. And at the end, we'll put forward some of these questions. Unfortunately, no questions will be answered during the speeches, but questions that are not answered will be taken back to the branch and answered and posted through our social media platforms. At the end of this event, I will tell you more about what you can do to help highlight this campaign. It's very important. But I'd now like to introduce and warmly welcome our UNISON General Secretary, Christina McAnea, to have a discussion with you this evening. Over to you, Christina.
Oh, Christina, you need to unmute. There we go.
Yeah, got it. Right. Okay, yeah, thank you so much, Neil, and thanks for inviting me. It's a real pleasure to be here with members from Suffolk, but also colleagues from Eastern Region, and I'm really looking forward to hearing from Kezia from the Living Wage Foundation, and of course, most importantly, from our care workers tonight. And I'm delighted that the work that's gone into your campaign, this is a campaign that's been really close to my heart. I made it part of my campaign to be General Secretary, but also it's something that I'm really pushing to make sure we keep it at the heart of what we do in Unison, that our campaign for justice for care workers is one of our top priorities in the Union. I particularly want to thank Neil Bland and the branch for all the work that you've done in pushing this up the agenda in Suffolk. From the brilliant march in November last year in Ipswich, which was so well attended and well publicised, and now the motion you're taking to the council and the rally planned in support of this on the 24th of March. It's a great example of Unison leading a campaign that matters, of course, to our members, but to the local community and to so many families and people who rely on social care. And of course, it couldn't be more timely, could it? With serious staffing shortages across the country, contracts being handed back because safe staffing is impossible. So we've seen increasing numbers of providers saying we don't want this contract anymore. And it's the result of years of underfunding, decades of underfunding, that means social care is in crisis right now. The system is broken beyond repair, and it seems that the government stubbornly refuses to do anything meaningful about it. Means millions leaking out of the system in profits. And of course, it means care workers being exploited and taken for granted. And, you know, I won't go on too much about COVID. We've all talked about it, but you can't think of what's happened in COVID without thinking about what's happened to this country, without thinking about what it's meant to care workers and to the people who receive care, because it's had such a devastating impact in that sector. You know, we were all scared when we went into lockdown about what it would mean. You know, many of us on this call will have been thinking, oh, what will it mean for me and my family? But actually, some people, particularly care workers, had to get into their work day after day, putting themselves at risk to be able to look after people who need care and support older people, disabled people, look after people in their own home as well as in care homes. And, you know, at the time, I can remember the Tories said they'd thrown a protective ring. That was the phrase they used, a protective ring around the care sector. I mean, seriously, nothing could be further from the truth. I mean, I don't know how effective the ring was anywhere else, but in care, it meant absolutely nothing. I spent the first few months in lockdown, and I'm sure other staff on this call will say the same, and other activists on this call. I'm sure, Neil, you and your branch colleagues would say the same. Inundated with calls from care workers. I was on day after day to the health and safety executive, to government departments, arguing with them constantly about what was happening in care, and where they were refusing to accept the reality that we were hearing about from our members who work in care day in and day out. You know, at the height of the pandemic, 90% of the calls we were receiving in Unison were coming from care workers. That's how serious this got. And it was clear to everyone, or at least it should have been, that care workers are making huge personal sacrifices. And yet, you know, you look at what's happened to care workers. Has there been any proper recognition of that? You know, most still earning less than the living wage. And it's the same in Suffolk as it is across most of England. And it's not just the pay either, but it's the stability of the jobs, with so many people, a quarter of the workforce, on 0 hours contracts. And for care workers in home care, that goes up to about half. And of course, training remains a massive problem. Too many staff given insufficient training. And then even when they are trained or gain experience, that's not being recognised in their pay rates or in the job they do. You know, I'm going to give you a statistic. Apologies if you know this, but a care worker with 5 years experience earns on average 6 pence an hour more than someone who's just starting. That's how little value the system places on the experience, on, you know, the expertise and the skills that people build up as care workers, and that is a shocking state of affairs. You know, and what do we see? When Boris Johnson got elected, he stood in Downing Street and said he had a plan for social care. It took 800 days almost for him to reveal the plan, and I use that word very loosely. It was trialled as a once-in-a-generation shake-up of social care, but I'm sorry to say it was more bluster and lies. To start with, the extra money being offered to the sector doesn't go anywhere near far enough. And, you know, they've talked about an extra £500 million going in, promised over 3 years, which is not a lot. But when you look at the detail, when I actually saw the detail of this, none of it, not 1 penny of that money, as far as I can see, is earmarked to go to care workers. And I remember thinking at the time when it was announced, and I'm sure other people did, what are they going to spend that money on? And the government said it was for recruitment and retention. And I thought, I bet we're going to see a lot more glossy ads on TV for what a fantastic career care work is. And it is a great career, it's just that you don't get the money to go with it. But I'm sure the advertising agencies are all really happy with that extra money that's going into the care system. But I doubt if you, or even have to say many of your employers, are probably that happy with it, because I'm sure they've seen next to none of it as well. And then we had the whole fiasco of compulsory vaccines. Now, and we've always supported vaccines in Unison. We encourage all of our members to get vaccinated. But regardless of what your views are on that personally, last year when they were planning to introduce, and did introduce, compulsory vaccines, and staff were losing their job and being sacked in the care sector, what was going on in Downing Street? I mean, the reports just came out today. I won't get into it because I've not had a chance to look at it in detail. But I mean, seriously, essential care workers losing their job and being threatened by the very people who thought the COVID rules don't apply to them. I mean, I don't know how, if you're a care worker who's lost your job because of this, I can't imagine what you must be feeling tonight watching the news about some of the things that have come out from this. But we know what's needed. It's not rocket science. It's precisely what your branch is campaigning for, precisely what you're fighting for. To pay at least the foundation living wage, at least the foundation living wage. To pay COVID-related sick pay, to pay occupational sick pay. And this is a sector, above all others, I would say, where you ought to be paying occupational sick pay, because as we know, presenteeism means people turn up for their work where they're not feeling well, they're sick, they're whatever. And what happens? You're in close contact with people who can't be put at risk. And therefore, it's absolutely essential that staff who work in the care sector get occupational sick pay. And of course, we need a decent pay structure, and we need quality training and career pathways. In short, we need a workforce plan. Now, we as a union will keep up the pressure on governments at Westminster and indeed across the UK. But it's your campaign that's essential, because this is where it makes a difference. Because if we can't get, at this point in time, national changes, we will be behind you all the way to try and force through and persuade providers, commissioners to make the changes necessary at local level. Because this is about making sure that we're looking after the care workers who look after the people who need care. So I'm never embarrassed about asking for extra money for our members, because when we ask for extra money for our members, it's because we know that if you treat them well, look after them, you retain them, that is good for the people who rely on those services. And it's good for councils to be engaging with local communities. And it's great that our branch, with Neil and all the others in the branch, are in there working with local councillors. And thank you to the Labour councillor who's going to be, to Sandy Martin, who's pushing the motion that's going to the council. Really grateful to you for that. And it is so good that you're actually getting coverage for this, that we're actually getting the message out there to local communities as well as to our members. Sorry, I've probably spoken far too long, but thank you so much, and I wish you every success with your campaign.
Thank you, Christina, and thank you for taking the time out of your busy schedule to attend tonight. I know you're very hard at work. Your discussions have been thought-provoking and uplifting, and I'm sure there'll be some questions later on. So if you're happy to take some questions at the end of it, that would be much appreciated. But thank you very much for taking the time to come this evening. So I'm now going to hand over to Kezia Pugh from the Living Wage Foundation. So over to you, Kezia.
Thanks, Neil, and hi everyone. It's really great to be here. I'm Kezia Pugh. I'm a campaigns manager at the Living Wage Foundation. I've been working on our campaign, well, our broader Living Wage for Key Workers campaign, which a big part of that has been growing the living wage in health and social care since sort of the start of the pandemic. And so I've been working on that campaign, and also going to be working and leading on our work in sort of growing the living wage as part of our London Living Wage City campaign, particularly in health and social care. I think some slides might appear relatively soon, but I'll sort of here to talk you through, I guess, the work we do at the Living Wage Foundation, the schemes that we run. Oh, perfect, I can see them coming up now. So yeah, there's the different schemes we run and the work that we do at the foundation, and I guess the real need for the living wage and social care more broadly. So if we could go to the next slide. Thank you. So yeah, last year we celebrated 20 years of the living wage movement, and I just wanted to give a bit of background behind how the campaign started really, and where we've got to 20 years on. So 20 years ago, the East London Communities Organisation had an assembly in Bethnal Green, which brought together a number of sort of local institutions and low paid workers essentially, and they organised around the issues that affected their lives, and an issue that came up again and again and again was low pay. And so the living wage campaign was started in 2001 as a result of that issue around low pay. 10 years later, fast forward 10 years to 2011, the Living Wage Foundation was set up to accredit employers who paid their staff the real living wage, and committed to sort of going beyond the government minimum wages to ensure that their staff had enough money to live on. And so 10 years on from that, with the foundation, we sort of celebrated 10 years of foundation last year as well. So we had over 9,000 employers who are accredited with us at the end of last year, who are sort of doing the right thing by their workers and setting a standard for employers to, you know, ensure that all their directly employed as well as any third-party contracted staff are paid at the real living wage rate. Can I go to the next slide, please? So what do we mean when we talk about the real living wage? So at the foundation, we want to be very clear in terms of our living wage is the only wage rate that's calculated independently, and it's based on the real cost of living. So that's what we refer to as a independently calculated rate by the Resolution Foundation and overseen by the Independent Living Wage Commission. And it's the sort of process in doing so. There's like a number of focus groups who agree a core basket of goods and services, and those goods and services are then priced according to sort of different household types and family types. And those prices are then sort of an hourly rate is calculated, taking those prices of those goods and services into account. So we have two living wage rates, and I think the next slide shows the two rates that we have. So £9.90 is the current UK living wage outside of London, and there's a higher rate of £11.05 inside London to account for the higher cost of living in the capital. These rates were announced in November 2021, and these rates were reviewed annually to sort of account for the rising in cost of living. So this was announced in Living Wage Week, which happens each November. And Living Wage Week is when we announce the new rates, but also celebrate the leadership of employers across our network, usually involving a lot of events up and down the country. Past few years has been slightly different due to COVID and event planning and everything, but usually involves a lot of celebratory events celebrating the leaders in our network, the workers who have been uplifted to the living wage, and telling those stories that we sort of feel are really important as part of the living wage movement. Next slide, please. So just a bit of background, really. I'm sure a lot of most people on this call are very aware of the problem in social care and why a living wage is so important. I think a number of these sort of statistics really highlight the need for a living wage in social care. So just to take you through some of these, there's currently 1.52 million people working in adult social care. And research by Skills for Care shows that 73% of these workers earn below the real living wage. This sort of as a problem is really articulated by the fact that 56% of domiciliary care workers and 24% in the sector as a whole work on 0 hours contracts, and this is something that really, so we run an accreditation scheme in terms of paying the real living wage, but we also run other schemes alongside that. So this statistic around 0 hours contracts I think really links with our living hours scheme, which talks about tackling insecure work. And for employers who sign up to our living hours scheme, it's ensuring that all of their lower paid staff have like a guaranteed number of hours per week. They receive sort of decent notice periods for shifts and guaranteed payment if their shift is cancelled. We think that all of these sorts of issues fit into the wider discussion about good work, about low pay, and ensuring that people can afford to pay their bills and can keep up with the rising cost of living. I think it's clearly also a gendered issue. Women make up 82% of the adult social care workforce. So this is something we're really sort of keen to highlight, I guess, on behalf of the foundation in terms of gendered elements of work and racialized elements as well, and ensuring sort of pay equity across different identities and different marginalized groups. Another sort of key indicator of the issue is obviously given the low pay and given this insecurity of work that we've been talking about, the average staff turnover in England for care workers is as high as 38%. And it's obviously a growing problem because the number of over 85s requiring 24-hour care is expected to double by 2035. So this is clearly something that, you know, needs addressing. And from our perspective, a living wage is a really great place to start. So I think on the next slide, go into, yeah, great. So just some reasons, I guess, and some background in terms of our accreditation scheme. There are two broader requirements, and I'll go into the process on the next slide. But we currently have, I think I've just checked, we've got over 300 accredited employers in social care specifically, which has meant a pay rise for over 14,000 care workers and staff who work across those organisations in social care. We have a number of local authorities who commission social care who are also accredited with us, and all of these employers, we've got a number of resources for social care employers who are keen to sort of accredit with us. And we've got a toolkit for that, and some of these the quotes on here from different employers are in the toolkit, and I'm happy to link that to everyone to share. But just to bring out some main points in terms of sort of improving retention rates and saving money. So we survey all of the employers in our network each year, and this is some work that's carried out by Cardiff Business School. And again, we get these really positive sort of headlines back from these surveys. So 75% of accredited organisations say the living wage has increased motivation and retention rates at their organisation, which is clearly sort of a big problem in social care at the moment. Overall, 93% of accredited businesses and organisations say the living wage has benefited their business. In terms of, you know, reputation and branding, 86% of accredited businesses say the living wage has improved the reputation of their business, and 64% say that it's helped, like paying the living wage has helped sort of differentiate themselves from others in their industry. There's obviously the sort of moral arguments behind paying the living wage in terms of uplifting staff and valuing your staff really, and rewarding staff for the you know, the challenges and demanding responsibilities that care workers have. There's also sort of links in terms of better quality of care and better staff morale as a result of being paid the living wage. And obviously, I think there's a lot of conversations going on within the sector and within the wider sort of health and social care conversations around integrated care systems and sort of providing, saving the NHS money, providing good quality social care also prevents the sort of need for hospitalisations and really having this more integrated approach between health and social care. And that's something that we're at the foundation also thinking about and how we can sort of fit the living wage into those discussions. So if we go to the next slide, I can talk quickly. I'm aware I might be running over slightly, so I apologise. I'll quickly talk through these last two slides. So the accreditation process that we have has sort of two main requirements, and the first one being to pay all directly employed staff the real living wage. So that's something that I've said sort of over 300 social care organisations have signed up to. The living wage applies to all staff over the age of 18, and as sort of mentioned, there's an hourly rate for the UK and a higher rate in London. The second requirement for our accreditation scheme is that all regular third-party staff are paid at the real living wage. So something that we've really noticed with sort of services often being outsourced, being at the lower, like in traditionally lower paid sectors. So that's sort of written into the requirements of our accreditation to ensure that all staff providing a service for an organisation are sort of receiving enough that to cover the cost of living. And if I can just go to the last slide. Oh, this is the one that takes a while. No worries. So yeah, there's two sort of broad requirements around the accreditation in terms of paying directly and third-party staff, and we have a sort of license agreement form that you can submit online once these steps are in place. We have increasingly growing accreditation team at the organisation who sort of look after regions, and we have specialist knowledge in the team who are able to sort of provide a guidance and support around key industries and sectors and the key challenges that certain employers might be facing in terms of implementing the living wage. So once, you know, an organisation inquires with us and is keen to accredit, that's the guidance that we're able to share throughout. So once submitting the license agreement, you sort of that's checked over by a member of our team and you're accredited as a living wage employer. And we really encourage all of our employers to get more involved within the wider living wage movement. We have a number of events that go on throughout the year. We have other schemes to sort of go further than accreditation and championing the living wage in other ways. So that's sort of including our living hours scheme that I spoke about earlier, as well as our living wage places scheme, which encourages anchor institutions and local employers to grow the living wage in their place, in their town, city, region. So I'll stop there because I'm aware I might be going over time, so apologies for that. But thank you very much for listening to me today, and I'm happy to take any questions later on.
Thank you, Kezia, for that. Like you said, it is fundamentally essential that we get the real living wages. And looking at the facts and figures, 1.52 million and 73% of them are under, not even near the limit. It's disgraceful. But thank you very much for coming to support our campaign today, and hopefully, like we said, we'll have some questions for you later on. So on to our next guest speaker. I'd like to hand you over to Sandy Martin, the Labour councillor, and over to you, Sandy. Thank you very much.
Well, thanks. And I'll just quickly go on. I mean, tomorrow, Suffolk County Council Cabinet will meet to agree the county's budget for the coming year. And they will almost certainly agree it without any amendments. We can be fairly sure of that. And then they will propose it to the full council, which will also agree without any amendments. And that's because one party has an overwhelming majority of the councillors, even though they got less than half the total vote. And any negotiations that take place are between the right of centre Tories, who want to restrict public spending, and the hard right, who want to slash it. But that doesn't mean that the campaign to win a decent wage for care workers is doomed to failure. Far from it. It's bound to succeed. And Unison is making sure that it does, although it is going to take us longer than we would like. You know, we want care workers to have a proper, decent wage now, but let's see if we can get it by the end of this year. I say us, I'm proud to be able to lend a hand to this campaign, and so are my Labour colleagues, but it is Unison's campaign, and it is the care workers themselves who are going to make it succeed. What I and my fellow Labour councillors can do is to provide opportunities to publicise this campaign. So when the budget was discussed at the county scrutiny meeting, we asked questions which we could publicise on social media. And tomorrow, our leader, Sarah Adams, will hopefully get the chance to ask more questions, though because Cabinet is essentially a Tory-only affair, this will be at the discretion of the leader of the council. When the budget comes before the full council on the 17th of February, we will get a few minutes to say what we think about care workers being paid often in effect below the minimum wage, let alone a decent wage. And then on the 24th of March, we will finally be able to put Unison's motion to require the council to make it a condition of all social care contracts to pay the real living wage. I know that we can work with the county branch to link that with a petition possibly and with a demonstration so that we can make the biggest possible splash on that day. We won't win the motion on that day. The leadership of the county council don't ever allow opposition motions to win, but we will win the argument. And if we can make the point public enough, we will win the campaign and care workers will finally get the wage they need. It's all too easy to despair when faced with councils and governments that won't budge. But I remember the 80s and 90s when teachers and nurses were appallingly badly paid. Gradually, campaigning by their unions and the Labour Party won over the whole country to the idea that their jobs were vital and responsible and underpaid. Well, we need to make that same case for care workers and for other healthcare workers. A genuinely decent wage would be at least £12 an hour. I believe we can achieve that eventually. But for now, the £9.90 per hour real living wage is the absolute minimum that any self-respecting local authority ought to be willing to see its care workers being paid. And even if we can't win the motion in March, I believe we can shame the county into delivering on that in the fairly near future and hopefully within the year. So please, please do get involved in the campaign if you aren't already. Join Unison if you haven't already. And if you are a member of Unison, please make sure that all your work colleagues join, because only as a united force can we win this campaign.
Thank you very much, Sandy. Thank you very much for attending this evening, and hopefully we might have some questions for you later on as well. So on to the next guest speakers now. These are the most important people here tonight. These are our frontline carers. So we are one down. A Miller who was due to join us this evening has become unwell, so unfortunately I had to drop out. However, we still have Jacqui, Ewan and Amanda, so I'm now going to hand over to Jacqui Clark.
Hi, thank you for inviting me to speak. Hi, my name is Jacqui and I'm 52 and I work as a support worker with adults with learning disabilities. First off, may I say I love my job. I've worked in care most of my adult life. I've also been poor most of my adult life. The two may be related. Anyway, to me it's not just a job, but a vocation. I really care about the people I support and I try to be the best that I can be and make a real positive impact on their lives. There's the old saying, chief cook and bottle washer, and that is true when it comes to being a support worker. Adding to that, personal care, supporting to give medication, helping people with their finances, shopping. Also, given that the people I support are non-verbal, it is also trying to gauge if they aren't well and what might be the matter. Talking to families and professionals, driving clients around, cooking and bottle washing, as well as making beds, cleaning and laundry. Also trying to comfort a resident if they're upset, trying to make their life as happy and independent as possible. I've also very occasionally been assaulted whilst at work. Thankfully, not very often, but it has happened. The parents of one of the people I support have told me of their gratitude and how it is so reassuring to know that their child is getting such good care. That to me is so lovely to hear and makes my job worthwhile. That's a basic summary of what I do. But add to that, I work in a home with 4 residents. Every single one of them came down with caught COVID-19, but the staff still came in. At the beginning, with not enough PPE, inevitably, 99% of the staff got COVID, and so did my son, presumably from me. Thankfully, all the residents and staff came through it, but it was very scary at the time. In fact, I got told one of the residents had COVID on Christmas Day 2020, when I had my late dad who had cancer. The utter terror I'd given my dad COVID still gives me chills. Before the testing and vaccines came into force, if you felt unwell, you had to self-isolate, and a lot of staff went unpaid if they had to self-isolate more than once. Support workers, carers, also work unsocial hours. I work all days of the week. My shifts start at 7:15 and a late shift ends at 10 p.m. This includes Christmas, Easter, etc. I don't get paid a lunch break, so just eat on the go. For all these things, I get paid just over £1,100 a month. Considering my rent is £675, yes, I do get universal credit, but I'm still robbing Peter to pay Paul most of the time. So although in principle, the clap for carers was a kind gesture, to see Boris doing it really was an empty gesture. I feel social care in this country has long been neglected and care has been looked down on, almost as if being a support worker is because you couldn't get another job. And it is true that standards do vary in care quality. But for someone like me who truly loves her job, it's quite disheartening that people just assume I'm too stupid to get another job. I'm actually currently in my 3rd year of an Open University degree. I hope this helps people understand why I think I deserve a living wage, and thank you for listening to my speech, Jacqui.
Thanks very much, Jacqui. Well done. Thank you very much.
Thank you.
Okay, we're now going over to Ewan. Over to you, Ewan.
Hi, thank you. Hello, my name is Ewan. I'm a community care assistant. I've been in the care industry for 5 years. The care industry is a skilled workplace because we have a responsibility to administer medication correctly and make the client's health has not declined. We also work with other health professionals. In our job, we have a lot of training yearly, and we need our own initiative in emergency situations, which depend on the client's living or dying on occasions. We are trusted with the lives of other people's families and members, and have a massive responsibility to look after other people's loved ones to make sure they are safe and well. I am on minimum wage. I work for 18 hours a day, most days which I only get paid for 13 hours. The office will book the first client at 6 a.m. and finish at 6:30 a.m. The next client will be booked at 6:30, and sometimes 10 miles away to get to the next client, so it's overlapping. And we feel pressured and unable to give the proper care. Our mental health is suffering because we are spending too many hours at work, and we have no time for families. And we have no social life, so there has been an increase in depression. Our vehicles are getting damaged and worn from going backwards and forwards to clients' addresses in remote areas, and we have to pay for the repairs. As we're seeing on the news recently, the care industry is struggling to help and recruit new staff because of finance issues like minimum wage. A lot of my colleagues are leaving a career that they love in the care industry because we can't afford to stay, as they are in debt and struggling to pay their bills, rent and upkeep of their vehicles. We only get 30p per mile, and the government guidelines is 45p per mile. The price of petrol is going up. I feel in order to keep people in care, we care about their clients. Sometimes drastic needs to happen before we lose good people who have been given their lives to care industry, and good start off with for the care industry to pay at least good living wage. Thank you.
Thank you very much, Ewan. Thank you for taking the time as well. Some of your points do resonate with quite a few of our members, so thank you very much. You did brilliant. And I'm now going to hand over to Amanda. So over to you, Amanda, and welcome. Oh, bear with us, you're still on mute, Amanda.
Okay.
There you go.
Hiya, thank you. Thank you for asking me to speak today. I do agree with what the other carers have said, totally 100%. So I'm 46 years old and I've worked within the care sector for the past 10 years. The last 8 being in a residential home with mainly residents that are suffering with a form of dementia. The pay is very low for the work we do. The pressure on care workers has become more and more, and with the COVID pandemic, it's just made it a million times worse. On a typical day, which starts really early, we become nurses, counsellors, cleaners, family, and on most occasions, the only face that a resident can get a form of comfort or security from. We're on our feet all the time, with no time for a cuppa or a chat, like in most jobs. God forbid, if we have to have any time off sick due to illness, we do not get sick pay and only get statutory sick pay. No one can live with that, really, let's face it. To qualify for sick pay would be fantastic. Not only do we wash, dress, undress, assist with feeding, give fluids, which is vital, make beds, tidy bedrooms and offer comfort to our residents, but a lot of the time we are being verbally or physically abused, making our job extremely hard, and that really doesn't help your mental health at all. Unfortunately, more and more people are being diagnosed with a form of dementia, which means there will always be a demand for carers. But I feel that if the system doesn't change, then a lot of good carers will leave, and this means that people needing care will suffer. And why? Because carers are not worthy of at least receiving the real living wage. Yet we are the people that are providing the love and care for the people that perhaps fought in our war to allow us to live the way we do today. Do these people not deserve to have the best care possible? Well, this will not be happening unless carers are respected and paid what they are truly worth. I'd really love someone from Parliament to volunteer for a week or two as a carer in a home where residents suffer from a form of dementia. I wonder how long they'd last. How many times on a daily basis they could explain to a resident where they are, why they're here, where their husband or their wife is, where are their children, and why aren't they at home looking after them? That is truly heartbreaking for the carers, and imagine what it's like for the resident. Yet carers are patient, kind, loving and giving. Yet carers are also the most undervalued, underpaid and disrespected part of the workforce. The elders who once cared for us are now needing to be cared for. It'd be nice for people to understand what a truly difficult job this is and pay us at least the real living wage or more. Thank you.
Thanks,
you.
Amanda. That's all right. Thank you very much, Amanda. You did really, really well. Thank you.
Thank you.
And thank you for taking the time to come as well and speak tonight.
You're welcome.